my name's Dr. Ben England, and I'm here with Dr. Raymond Butts, and we're really happy to have the CEO and president of ARPWave Technologies, Colt Thompson. So, Colt, welcome to Fort Wayne, Indiana. Welcome on the Torrentia podcast.
Yeah, thanks, Ben. Yeah, it's great coming out here and hanging out with you guys. Got to run around the town, have some good food, and learn a lot, you know. So the network you guys have out here and the things that you guys have been doing with your patient load, I mean, it's great to be a part and be on the podcast and here learning with you guys.
Yeah, well, I just want to start us off and just really ask the question, what is ARPWave and why should medical professionals know what ARPWave is?
All right, let's cannonball into it, huh? So ARPWave, ARP stands for Accelerated Recovery and Performance. And the name kind of had stuck over the years as we progressively built into the therapy system and the protocols that we had developed. On average, we were yielding a 20 to 40% faster recovery time with a lot of the different conditions that we had worked with, both on pre and post-surgical application, non-surgical application, bringing people back to the field of play, but then also helping people just get back to doing things in life that they want to do. And some of these things that we think are so simple of walking up and down stairs, or, you know, the example a lot of people do use is, getting down and up from the floor with grandkids or picking kids up or being able to put bins away. I mean, just some of those simple activities, and allowing people to have freedom in their life and getting back into that lifestyle, I guess, so to say. But yeah, you know, getting into past the acronym and like, what is ARP? I mean, it's really a therapy system which we incorporate different modalities to achieve that result. I don't know if I can jump into this, but I mean, you know, kind of getting into what we've been doing here and talking about like the different applications of ARP and the different frequencies and the comparisons of that, and like just bringing that out to the world is really, you know, one of the opportunities that brought me to Fort Wayne with you guys today. So
Awesome.
I'm sure we'll kind of dig into that a little bit more as we get going. But
Yeah, so what you're telling me is ARPWave is not just simply sticking some pads on a person and calling it ARPWave and moving on.
No. And that's been the big misconception. You know, a lot of times it's like, it's this machine and yeah, you put some pads on, turn it up, and all of a sudden like, I'm feeling better. No, I mean, it is a system, and that system kind of gets into incorporating exercise into pad placements, getting into treating the cause of the problem versus just the symptoms. So really kind of breaking that down, asking the right questions, working with the providers to take their expertise and their knowledge into the field that they're in, and how can that complement their therapy. That's been, you know, another thing that's been great with ARPWave is it's not just one specialty that we can work with. I mean, we really dial into a lot of different medical professionals, you know, from the trainers to the orthos to the chiros to the PTs, and there is an application for all of those different specialties to kind of get into like, yeah, my knee hurts, but why does it hurt? Or my shoulder hurts, again, why does that hurt? And kind of breaking that down and really complementing, you know, those different professions. So
Awesome. Well, we met you, you know, kind of through a mutual friend. I mean, Ray and I did, and, you know, we kind of first, you know, met, and really our topics of conversation surrounded research. And really one of the things that, you know, we've you know, kind of discussed over the past few months, over the past year and a half, is, you know, the research on multi-waveform technologies is growing. And Ray, you recently did a pretty large, you know, scoping review of single waveform technologies. Maybe you could share with some of our audience the differences between single waveform technologies and multi-waveform technologies like ARPWave.
Yeah, I think traditionally in the world of rehab, the waveforms that we are used to are microcurrent and TENS, both low and high frequency TENS, NMES, functional electric stimulation, KFAC. I mean, these all give us, you know, different things that there are a lot of different reasons to use them in the clinic, right? They help us in different ways. The way I usually say it is that, you know, microcurrent really helps to put the tissue into a state which is more conducive to repair, whereas the TENS and the interferential current really help us with with pain and helping us to move our body in a way that is more comfortable, and then we really can zone in down onto the neuromuscular junctions and the alpha motor neurons and the muscle fibers by using NMES and FES in conjunction with exercise. I think what makes Colt's company, so special, and this business of multi-waveform technology is just the prospect of maybe taking the very best aspects of all of these individual waveforms that I think that most of us are familiar with, and being able to put them all together, and not only put them all together, but to kind of act as a DJ, whereby we can kind of put them together in a way which creates unique interactions down deep in the tissue where the problem is, where the neuromuscular junctions are, and do it in a way where we can certainly bias what the problem is. In other words, we can bias the interactions of those waves in order to spend more or less time in low frequency tens or high frequency tens or NMES or whatever it is, based on how the patient presents to us. So, you know, I think this sort of conversation is really important because, as rehab professionals, exercise is the foundation of what it is that we do. We all know that exercise is medicine. It is really, really important. There's no argument there. But it's how we can do the exercise within the time constraints of rehab in the clinic, and then make the exercise and the loading that we do much more efficient. In other words, let's be able to get the results that we want, but do it in a way which is safe and comfortable and meaningful, so that we can continue to progress the patient and then be able to make the argument that we can get the patient better in a lesser number of treatments, right? This is really where we significantly increase the value of what it is that we do. So, from a Torrentia perspective, we really advocate multimodal treatment and a better understanding of both the how and the why of what we do. And I think, ARPWave, a multi-waveform technology, it just fits perfectly into that. And perhaps it is the ultimate way of augmenting exercise in a way where we can finally make the argument that the exercise that we provide is distinctly different than other clinics, other professionals, and maybe it's finally a way that we can make the argument that we're really bringing the sexy back to exercise.
Yeah, and Colt, you talked a little bit about it, already, with, the outcomes that you guys have been seeing for decades really are about a 20 to 40%, increase in, really the speed at which somebody recovers. And, Ray, you just spoke about exercise and really why exercise is inefficient, which, it can take 3 to 6 months, as we know, to even build muscle with a good, regimen or training program. But with ARPWave, what we're seeing is that, from a literature standpoint, is it's accelerating the rate that muscle grows. It's accelerating the rate that tissues heal. And that's really exciting, kind of for the future of medicine. So, Colt, I just want to ask you, how did ARPWave start? Where did it come from? What's the genesis? What's the origin story?
Yeah, and just even adding on some of the stuff that you talked about too, with it being an active therapy too, you're also incorporating the movement patterns to help break down compensation patterns, and that's been one of the elements that's always kind of stuck with ARPWave. So I think it'd be a good transition. But the concept of a compensation pattern somewhere in the body being a compensation pattern everywhere in the body, even if you get into building the strength and you get into dealing with where the force ended up, you get a surgery, you get a ligament repair, but you still have those compensation patterns. A patient is still going to be going back to those same movement patterns, which, still has force transferring to areas it shouldn't be going into. And at a high level or a high rate of force absorption and creation, there's that susceptibility to re-injury or re-damage to the tissue. So, with the waveform, with the technology, with the therapy system, that movement, that exercise is a key component to the whole process. But, kind of rewinding the whole story of ARPWave and kind of where things kicked off, it was just always our family, being really active, and just always kind of looking for that next big thing, the next cool thing. Our family was always into kind of health and wellness, attending a lot of trade shows. And yeah, I mean, close to 25 years ago is where my pop, Dennis Thompson, ended up meeting a guy named Gary Thomas at a convention and a show, who had kind of this device that he was bringing out into the market. The two of them, in a collaboration with a couple other providers over the years too, with Jay Schroeder and Dr. Steve Moe, Dr. Jay Pietla. I mean, there's a whole conglomerate of what got ARPWave to where ARPWave is right now. But yeah, I mean, over the years, it really came down to, how do we get a muscle out of protection? How do we get a patient moving freely without pain? That concept really rolled into then, do we put the pads on and do we just turn it up to a light intensity like a lot of stim? But no, it evolved into all right, now we're getting into different pad placements. We're getting into those proper movement patterns. We're getting into some of those resets. And when you do that, the thing that's been cool is we're not just addressing one or two components of rehab each session. It's really kind of 3, 4, 5 steps of that rehab each session, which really helps us kind of propel to that accelerated recovery. But yeah, I mean, the story and the time that we have, I mean, I'm more than happy to share that maybe on another time. I mean, we'd be here all day, and I could take this story on and on and on. I guess as far as the elevator pitch goes, yeah, I mean, just really kind of breaking down the neurology, the components of the device with active therapy.
So let me ask a question, if you don't mind. I know that there is a number of multi-waveform technologies that have kind of hit the market. I think they're all a little bit unique in their own way. We'll call it your competition. I mean, I guess my question is, what makes ARPWave the go-to? I mean, how does ARPWave really stand out above the rest? Why should I take a second look at your company, particularly when it comes to rehab and performance?
Yeah, and I think that ties into even the history of where things started from. Like I said, I mean, ARPWave's been around for 25 years. A lot of these other technologies kind of coming out, one, are pretty fresh. A lot of the multi-waveform technologies actually came from ARPWave. Some of the different therapy systems and things that they're bringing into the market is stuff that people are trying to reinvent or trying to create when ARPWave already has it, and we're kind of at that next tier. As far as rolling it into the waveforms and the technology and kind of the way that things are implemented, when we get into just the multi-waveform technology, you're really hitting a lot of different aspects, allowing that patient to move with that high intensity. You're able to use kind of the higher output power to break down compensation patterns, but also build up strength faster. When we get into then blending that into, or blended therapy or blended waveforms versus multi-waveforms, I think you do a great job of explaining this, Ray, and getting into, being the DJ and putting together the song for each patient. With a lot of these other modalities, you could probably achieve similar, I don't even know if I'd say similar results, but you would have 6, 8, 10 pads and 5 different devices on you to try to get this multi-waveform that ARPWave has, versus taking those single waveforms to achieve the same results. Again, it's kind of the 4 steps in one rather than one at a time, which helps us kind of propel that forward.
Hey, it's Bruce and Ben. We wanted to take a moment to welcome you to our YouTube channel, Torrentia Medical Education.
Torrentia was created for rehabilitation professionals of all kinds to really work together to start changing the way that healthcare is currently being practiced and what the future of healthcare looks like.
We hope that our content and community helps inspire you to be a part of the next level of clinicians that are going to treat our patients out in the world today.
Beyond just joining us in our free community that we call the Torrentia Tribe, you can also check out some of our events on our events page at torrentia.com. Each and every one of our orthobiological hacking conferences and events and future events to come is really designed to help you really master and learn these regenerative concepts, as well as take charge and move the rehabilitation profession forward.
We're really excited about the orthobiological hacker certification, and we have much more content coming. So subscribe, check out our YouTube, check out our website, join the community, and we hope to see you at our events.
And remember, a storm is coming.
Thanks so much for watching.